Come in.
Hi, my name is Adrian Alba. I'm going to be your student nurse today. So today I'm going to be doing a physical assessment on you. Is that all right?
Yeah.
Okay, thank you so much. Let me just close the curtain for you. Can you please verify me your full name and your date of birth?
Sure. Alexander Mendoza, born September 3rd, 1994.
Alexander Mendoza, September 3rd, 1994.
Mhm.
Okay, perfect. So can you please lie down for me? I'm going to first assess your skin.
Sure.
Okay, your skin, you have a very even skin tone. I'm going to just check your arms, other arm, legs. Okay, no signs of pigmentation, no discoloration. Your color is medium brown. You're warm bilaterally, and your skin is dry and clean. Now I didn't see any signs of bruising. However, I did see some minor scars on your right elbow, like 3 little scars, about 1 inch each. Next, I'm gonna check for your skin trigger. So over here. Okay, you have a very good skin trigger. Next, I'm gonna check your lesion. I notice you have one on your left cheek. So let me check it closer. So it's asymmetrical. The borders are uneven. The color is brown. The diameter is approximately 0.5 centimeters, and it is flat. Okay then, so now let's move down to your extremities. So for your extremities, I'm looking for any signs of edema. I don't see any swelling or inflammation. So I'm going to be doing the pitting test on you, on your medial tibial bone. Okay, no signs of edema, no indentation, so that's good. Next, I'm going to be assessing your hair. So can you turn your head this way? Turn your head the other way. And then pull your head back. Okay, your hair color is black. It's black, it's fine and straight, it's thick. It's well distributed throughout your scalp. There's no signs of any lesion there, and your scalp is nice and smooth. So next I'm going to assess your fingers. The curves are nice and round. The nail is flat, and the angle of the nail base in the nail is 160 degrees. And I'm going to check capillary refill. 1, 2, 1, 2. Okay, good. Here, the curve is also round. The nail's flat. The angle is 160 degrees, and the capillary refill. Okay, good. Less than 2 seconds. So next, can you sit up for me, please? I'm going to be assessing your head. So I'm just going to be palpating your head. No signs of lumps, no pain upon tenderness. Your head is symmetrical, it's round. I'm going to check your temporal arteries. Okay, 2 plus upon palpation. Now your temporal mandible joint. Open and close your mouth. Good, very smooth movements. Next, I'm going to check your facial symmetry. Eyes are aligned, ears are aligned. Now can you move your eyebrows up and down for me? Good, now can you puff up your cheeks? And then can you smile with your teeth? Perfect, very symmetrical. So next, I'm going to be assessing your lip knots. So I'm just going to palpate starting here, the preauricular, postauricular, occipital, the jungular digastric, the submandible, submental, superior cervical. Next would be the posterior cervical. Now I'm going to be checking your deep cervical nodes, the deep cervical chain. And lastly, the supraclavicular lip nodes. Okay, good. No signs of swelling and no pain and tenderness upon palpation. Next, I'm going to be assessing your neck with your range of motion. So move your neck forward, now back, side to side, and then touch your ear to your shoulder. Perfect. Very fluid movements and well controlled. Next, I'm going to be assessing your trachea. So move your neck up. You're going to feel a bit discomfort here. So, okay. Okay, trachea is midline, no signs of shifted or inflammation. Next, I'm going to be assessing your trapezius strength. So I want you to shrug up your shoulders and then resist me pushing down. Okay, good. Good strength. And then next, I'm going to assess your sternocleidomastoid muscle. So I'm going to turn one way. I want you to resist, okay?
Okay.
Okay, good. Okay, good. Now I'm going to assess for your carotid artery. Okay, 2 plus. 2 plus, perfect. Now I'm going to be listening for any bruise along your carotid artery. So I'm going to be assessing 3 spots. So I want you to take a deep breath every time I assess these spots, okay? So first, angle of the jaw, take a deep breath and hold. Good. Now the midline of the cervical line, take a deep breath and hold. Okay, good. And then next, the base of the neck. Okay, good. Sounds are present. So same thing here. So deep breath and hold. Okay, good. Deep breath and hold. Good. And then deep breath and hold. Okay, good. All sounds of bruise are present. Next, we are going to assess your eyes. So please take off your glasses. Now open and close your eyes tight. Okay, good. Eyelids are no signs of redness or swelling. As color tone is the same as skin tone. Next, I want you to look up and I'm gonna assess your conjunctiva. Okay, conjunctiva is transparent. Lower lids are pink, blood vessels are visible, and sclera is nice and white. Next, I'm gonna assess your cornea. So I want you just to look straight, and I'm gonna shine the light on the side of your eye. Okay. Okay, both corneas are clear, no signs of cloudiness. Next, we're going to do the pearl assessment. So I want you to look straight at me, and I'm going to shine the light across your eye, each eye. Okay, good. Okay, good. And now I want you to focus on this pen light as I bring it closer to your eye. Okay, good. You passed the pearl test, and both pupils are equal. They're round. They both reacted to light, and they accommodated well with the object. Next, I'm going to assess your corneal light reflex. So I want you to look at me, and I'm going to shine the light right here. Okay, good. Both corneas reflected to the light, both on the same spot for each eye. So next, I am going to, so earlier we actually did the Snellen chart with you, and so your results for the visual acuity test was 20/20 with the help of your glasses. So that's a good score. So next, we're going to do some eye examination. So if you can, put on your glasses. We are first going to do the cover test. So I'm going to cover one eye, and I want to keep your uncovered eye focused on me. Okay? Okay, good. One more. Okay, good. Let's go with the other eye. Good. Okay, good. No signs of lateral movements. Next, we're going to do the confirmation test. I want you to cover one eye. Keep this eye focused on my eye here. And without looking at my hand, how many fingers am I holding up?
3.
Good.
2.
Good.
1.
Good.
2.
Okay, let's do the other eye.
2.
Good.
3. 2. 1.
Okay, good. Your visual field is intact. That's really good. And now we're going to do the 6 cardinal gazes. So I want you to focus on the pen light as I move it to different directions. Don't move your head. Okay, good. Your eyes paralleled well as you track the object. Next, I'm going to assess your ears. So your ears are both aligned, symmetrical. No sign of redness, no lesion, no nodules. Both ears on our adult side, they are less than 10 degrees. Now I'm going to palpate your tragus. Both firm, no sign of pain or tenderness. Now your mastoid process. Okay, both firm, no sign of swelling or tenderness upon a palpation. Next, I am going to do a whisper test on you. So I want you to sit here and cover one ear like this. And I'm going to whisper 3 sets of words or letters to you, and I want you to say it out loud what you hear, okay?
Okay.
Okay. C, 7, F,
C7F.
Okay, perfect. Now the other ear.
Okay. D610.
Okay, perfect. Great, you passed the whisper test.
Mhm.
So next, I am going to assess your nose. So your nasal bridge is symmetrical. No signs of redness, no swelling, no deformities. Gonna just palpate a bit. No signs of pain or tenderness upon palpation. Now let's test your patency. So I'm gonna cover one. I want you to sniff for the other. Okay, I have slight obstruction. Now the other one. Okay, you have a slight obstruction on your right side. So let's see if there's any discharge underneath. There's no discharge coming out. However, I'll make note of that. So next, I'm going to palpate your sinuses. So let's palpate frontal. Okay, no signs of pain or tenderness up here. Now the maxillary. No signs of pain or tenderness down there. Okay, good. So next, what I'm going to assess is your mouth. So let's check your lips. Your lips are nice and pink. Now underneath your lips, nice and pink. Gums are also nice and pink and intact. Blood vessels are showing. So above, upper lips are nice and pink. Gums are also nice and pink and intact with the teeth. Blood vessels are showing. Now show me your teeth. Teeth are white and aligned. Now say ah. No sign of debris, no decay. Now show me your tongue. Say ah. So your tongue is midline, is smooth, no rugged. Now underneath your tongue, underneath the tongue is also nice and pink. Blood vessels are visible. So next, I'm going to assess your ducts. So let's check your sternum ducts on the side. Say ah. So sternum ducts are intact, nice and pink, no signs of swelling. Underneath the upper second molar. Same thing on the other side. Are you okay? Okay.
Yeah, thank you.
Also nice and pink, no signs of swelling or no inflammation. Now let's say underneath your tongue. Your tongue is also nice and pink. This is the Warren's duct, and the ducts are intact, and all saliva is present. So that's a really good sign. And then let me see your tongue one more time. Okay, move it side to side. Okay, no signs of tremors. That's a good sign as well. So next, I'm gonna check out your tonsils. I'm gonna use a spoon. So say ah. Oh, I noticed you don't have any tonsils. Did you get them removed?
Yeah, I got them removed like 10 years ago.
Oh, okay. I'll make note of that. So next, I'm gonna check your uvula. Oh, you just need the spoon again. So say ah. So say ah and move your uvula. Okay, one more time. Say ah. Okay, good. Your uvula is midline and moves along as you say ah. So just open your mouth wide for me, please. Okay, no signs of lesions in your oral cavity or your lips. Next, I'm going to check your hard and soft palate above. So put your head up for me. Hard palate is rugged and pink. Soft palate is smooth and pink. No sign of redness or inflammation. And lastly, I'm going to check your pharyngeal wall, which is the back of your throat. So just say ah for me. So no signs of swelling, no redness. It's all nice and pink. No bleeding, no erythema, and no postnasal discharge. And let me see your hard palate and soft palate again. Oh, no petechia as well. So overall, I assessed everything. Do you have any questions or concerns?
No, I think I'm good. Thank you.
Okay, thank you so much for your time.
Oh my god, a minute.